All right, y'all. In this video, we'll be going over the adductor PAILs rails or abduction, PAILs rails, and a frog position, right? So, frog position, those most of us, I feel all of us know. We're going to come down to our chest or our forearms. It's going to look so different for everyone, right? But our hips are splayed out into abduction. We're going to try and get our shins parallel to one another. And again, some people enjoy feet closer together, wider apart. Base foundation to play with starting out is trying to get your shins and feet parallel to one another. Once you're in this position, you're going to give an anterior pelvic tilt, so tailbone comes up towards the ceiling. Maintain that and shift back gently until you feel a good stretch through the groin, right? As we know, once we find that good stretch, we're going to maintain that stretch for 1 to 2 minutes, ideally 2 minutes, right? Anything more than 2 minutes is kind of redundant. 1 minute is the absolute minimum. Maintain this stretch for 1 to 2 minutes. PAILs, isometrically ramping from 10% to 100% safest max effort, isn't pulling your knees in. Think about your femur here, both femurs on each side, engaging diagonally as one unit towards the midline. That's the PAILs contraction, 10%, 20%, 100% effort. Holding that for 3, 2, 1, and then coming out at a 45-degree angle, the opposite direction, engaging those outer glute muscles, not just driving our knee that direction, but out that direction, both sides unilaterally, bilaterally, right? So again, pulling the tailbone back, shifting the weight back, maintaining this stretch for 1 to 2 minutes, 10%, 20%, 100% safest max effort. PAILs, driving in at an angle towards the midline, engaging those adductors. 3, 2, 1, flip. Driving out at a 45-degree angle, the opposite direction at 100% safest max effort. When you rails, try not to shift forward. Maintain that pelvic tilt and the exact position you're in, and just squeeze as hard as you can to get the quads, the femur, and the hip joint to go out at the opposite direction. Holding that, maintaining that 100% safest max effort for 15 seconds, 3, 2, 1. Relax, don't fall out of it. Try and shift, maintain that pelvic tilt and shift your body weight back. Find that new end range for 3, 2, 1, and gently come out of it.